All right, I told you I had more. This is a 3-part series on what you need to expect if you're going to be a post-surgical caregiver. Here's some things that you should talk to the surgery team about. Let's go ahead and get started. Handling medical equipment. Some procedures for home use will require that you use a drain, catheter, or monitors or other equipment. So ask for training or demonstration on how to clean and operate any medical equipment that you will have in the home. Lifting restrictions, why it's so important. Improper lifting can harm both the patient and the caregiver. So confirm how much the patient can lift and for how long. Ask about caregiver strategies for mobility in assisting the patient. Caregiver physical strain. Caregivers often face back pain or fatigue from physically assisting. So ask if physical therapy or a home aid is recommended to reduce strain. Scheduling follow-up appointments. So missed follow-ups can delay healing or overlook complications. Ask when and how to schedule follow-ups before the person is discharged. Transportation needs. This is so important because patients often can't drive for weeks after post-op. Confirm how soon driving can resume and what transport options are covered by insurance. And make sure the person has support. Yesterday, I was in the pharmacy and there was a guy who had back surgery on Thursday, but he was there picking up his prescriptions on a Saturday. That's a hot mess, but he didn't have someone to do it for him. So you want to make sure that all of that is arranged in advance. Infection risk. Post-op immune systems are often weak, so ask the team how to maintain a clean environment and what hygiene precautions to take. Support with toileting is so important because patients may need help using the bathroom or cleaning themselves. Ask what level of support is expected and if any toileting aids are recommended. You know, they have those little toilet seat attachments that may help them to get up a little bit smoother. You got to ask these questions because you don't really anticipate it, but I have it here for you so that you're already prepared. Monitoring fluid intake and output. This can indicate healing or problems, especially with the kidneys, bladder, or heart surgeries. So request guidance on how to track this and what red flags you should be looking for. Are there any home modifications? This is so important because stairs, bathrooms, or beds might not be accessible post-op. So ask if an occupational therapist can assess home safety before the person is discharged. Preparing for cognitive impairments. Some patients experience memory issues or confusion post-surgery. So ask if cognitive changes are expected and what to watch for. Now, ironically, these tips are not just limited to those who are elderly, but it could be your spouse. It could be someone younger. But these are the things that you need to know. As always, we're here for you. Don't forget to go to HansonCaregivingConsultingServices.com for more information. I'm going to put these pointers on the website. It'll be dropping soon so that you have access to it so you know exactly what to ask for. I'm going to do the last video of 10 more suggestions that you want to ask the surgery team while you're going through this process to prepare to become a post-surgical caregiver. Until then, don't forget to like, follow, repost, and share. This is your girl, Essie. I'm out.